Knee replacement surgery. What to expect? When patient comes for knee replacement, there are a particular set of expectation the patient has, and it is very important to answer what expectation patient should keep and what expectation patient should have and what are going to be the results. First and foremost thing, the patient should be ready for an inpatient, that is when in the hospital physiotherapy, and some pain will be there, but with medication it is controlled. Patient should expect standing, walking with support within 1 or 2 days. He should expect that he should be having reasonable range of motion like 0 to 90 degrees by the end of 7 days. He will have almost full range of motion by the end of 1 month and 1.5 months, and the complete and total recovery from knee replacement can take up to 3 months. But the expectation that patient will be normal within few days of surgery is unreasonable, and it requires work on the part of patient as well as from the physiotherapist and the operating surgeon. Thank you.